Now, I'm so excited I've made it. We've all made it. To discuss the women's health agenda, I'm really excited to have Jessica Baladad. She's founder and chief advocate of Feel for Your Life. Please welcome Jessica. And then Dorothy Fink, Deputy Assistant Secretary for Women's Health and Director of the Office on Women's Health in HHS. Thank you so much. Great to have you both here. Thank you. Dorothy was with you last night, and I think I've been here ever since I saw you last night. You know, it's been quite a long day of discussing every corner of the health ecosystem. And Jessica, I just have to start out and just say, I want you to tell our room your story.
I was diagnosed with breast cancer at 33 years old after finding a lump in my breast while doing an intentional self-exam in the shower. I was diagnosed with stage 2B invasive ductal carcinoma, went through 16 rounds of chemotherapy, 24 rounds of radiation. I had a double mastectomy, a prophylactic hysterectomy, and a 10-hour flap reconstruction where they took fat tissue and blood vessels from my stomach and placed them into my chest to recreate my body. All of that, I turned my story into a passion project called Feel for Your Life. That's how it started. Feel for Your Life is a free app that shows women how to perform self-exams, lets them track and monitor their progress, and set monthly reminders. There's also an AI tool called Breast Friend AI that will allow you to take your pathology reports, translate them into terms that you understand, and automatically populate questions for you to ask your doctor. It's been downloaded more than 200,000 times all over the world and is saving lives every day.
Tell them what state you're from.
I'm from Nashville, Tennessee.
Tell them when you were going through this process, how some of your friends and colleagues were reacting and interacting with you as you were finding your own agency in this process, what you discovered with your friends.
So I was talking to my friends when I was coming out with that I had breast cancer. I'm like, hey, if you're gonna see this bald baddie at the grocery store, it's because I have breast cancer, by the way. And at that point, I was making jokes about myself because I had looked like the love child of Britney Spears and Uncle Fester, and I just didn't care anymore. But they were like, yeah, it's okay to laugh because I sure do. How did you know to get diagnosed? And because you're so young, I'm like, well, I do my self-exams every month, don't you? And it was as quiet as the room just was just now. It was just crickets. And I learned there were 3 reasons women weren't doing self-exams. No one showed them how. They were uninsured or underinsured, or they felt ashamed of looking or touching their bodies. And so I use those things to overcome some of those education gaps to inform women that this, you can literally put your breast health in your hands and save your life.
Jessica, Dorothy, as I listened to this very, very powerful story, and I was just sort of looking for the name of another friend that was just up here, Chris Curry from Aura and Aura Health, and she made something I just really didn't know about, which was, the broad, lesser developed ecosystem around women's health, and this is your job. I mean, this is what you're trying to, remedy and address, which I have to say, I'm, another point of ignorance. I'm here to learn. I had no idea that women's health was in a kind of position where it's sort of been treated as a second citizen, if you will, in some of this. And I hear this story, this agency, and I'm interested in what problems, as we're kind of talking about technology, how can we leapfrog out of a crappy situation of imbalance in health to something better?
Well, first off, thank you so much. That's such a powerful story. And we're always trying to think about how can we get women screened earlier. You had diagnosed at such a young age, and how can we even think about breast cancer in a totally different way, because so many times people think, oh, that's something I have to worry about at menopause, but it's not. And so it's always just changing so many of the things that you're taught during medical school, and it's always based on the data that they have at the time, but then it's how do we translate the most up-to-date data into the lives of real patients? And how inspiring is it to have patients who can say, the system was not going to diagnose me at the right time. I was able to get answers myself and get the best treatment and be here today helping other women save their lives. And so we are all about thinking, how can we get to all those innovations? But then I would also say there are a lot of these things that we know. Like we know mammograms save lives, but we don't always get them. We have so many things that we also know, but don't get translated into real day-to-day care. And so that's what we're all about as well. But then I'll also just say from an affordability standpoint, right now we're really making leaps in terms of getting women access to medications. When you think about all that is being done through TrumpRx.gov right now for women, whether it's through fertility, through looking to get access to the GLP-1s, and just all the new generic drugs that are on there, it's also thinking about the affordability aspect of all of this.
So affordability is really important. I mean, and you sit in such a important position nationally, but I'm always worried about people in your kind of job because there are so many expectations of you. And the truth is you don't have huge resources, right, to do it. So what are the best methods, in this world that you kind of get the message out or you move resources? I think one of the biggest problems anyone has in government is getting people out in the rest of the country to understand that they're there as a resource. So how are you doing it?
Well, let's take the Women's Health Initiative for an example. And so back in 2002, all women were told, you should not take hormones. If you take hormones, you will get breast cancer, you will have heart disease, you will die, don't do it. And think of the generations of women who have suffered because they haven't had access to hormones. And so what has been great is HHS took a closer look at those studies over the past year, and they said, actually, what we know now is not the standard of care in 2002. We need to reverse those black box warnings and get the message out there so that women can have real, honest conversations with their doctors around hormone replacement therapy. And so some of it is saying, here's what we think is the standard of care, but it's also being able to have honest self-reflection. I mean, that study came out of the NIH, out of NHLBI, right? It was a government study that really ruined women's lives. And I'm sorry to say that, but it's true. And so it also takes people who are willing to look back and say, hey, we have better data now. We can't continue to have women come in. And I can't tell you, as an endocrinologist, how many women would come back in with their hormones, even if it was just vaginal estrogen. And they would say, but I looked at the label. I can't take this. And you're prescribing it for painful sex or recurrent UTIs. And they won't take it because of that black box warning. And so a lot of things in healthcare, and specifically to women's health, is how can we really look critically at the data? And even if we've looked at data a certain way many years ago, how do we look at it with the most up-to-date evidence and make sure that women are getting those options?
Jessica, in your world, and I guess you kind of stumbled into this. You did it. I guess the term is you felt agency in your situation. Lots of other people don't. I remember my mother. I wish my mother had known you. I mean, we might have had my mom had a hard time feeling like she could ever be in control of a process when she had breast cancer. And, it was a frustrating thing to watch and observe. And so you've created something to help people have a step into that. Do you see possibilities of broadening the journey into other healthcare, tracks related to women's health?
Absolutely. I often say, cancer didn't just happen to me, it happened for me. And being the fourth generation on my dad's side of the family to have breast cancer, 14 women altogether, no known gene mutation that science has been able to identify yet. And cancer doesn't just run in my family, it sprints. It's not the only cancer that runs on my dad's side of the family either. So, I've been approached about doing other apps for other disease states as well. So it's on the table for me to consider and to think about developing. So it's just something that I kind of keep in the back of my mind.
Dorothy, another thing we've been talking a little bit about on the edge of is, the Alzheimer's has come up a lot, the aging, American population. And the fact is, and I'm going to just be honest about it, women are the backbone of a lot of families and caregiving. So too are some men, but women, mostly in this space. And so when I kind of look at, the very complicated burdens, right? Their own health, other people's health, caregiving, holding this stuff together, I'm just wondering whether or not, as we're sort of looking at this bold bets thing, is there any sort of approach when you begin thinking about technology? Maybe it's just information, maybe it's just helping people have it, of some element or a platform that might decrease the burdens for caregiving, particularly women that are caregiving, and addressing their own needs in health. What would that be?
For sure. Well, I also want to address your Alzheimer's point, because so many people will say, women have more Alzheimer's, they live longer, and, they're caregivers, and they just take this all on, and that's just because they live longer, which is crazy, right? We know that estrogen plays a critical role in brain health for women, and so I want to stay on my estrogen plug for a second and just say, at our first ever National Conference on Women's Health earlier this year at HHS, we really took on the topic of menopause as well as Alzheimer's, and during those discussions, we had Dr. Roberta Brinton from Arizona talk about her research into the critical window of hormone replacement therapy for brain health. And when I was in training, it was, you'd never give hormones for brain health. And now she's unlocked so many fascinating areas to help women with their brain health, because, I don't think as a woman, you're not ever going to just say no to your caregiving duties, right? And a lot of times people talk about the sandwich generations when you're looking out for your parents and then you have your children. And, what's crazy is we were talking backstage. I actually was with my mom this morning. She had breast cancer when I was in college, and if you can believe it, she has it again now. And thankfully, she did her screening, and she's gonna hopefully be okay with, with all the advances we have even over the past 26 years since she had it. But it's also something where, I will never stop, not just, you leave your doctor role, you want to be in your daughter role when you're with your mom, but you can't help think about the realities of these risks. And when you're in these positions as a woman, you want to be able to be there. You want to be able to be here in your career. You want to be able to be there to help your mom. And then, last night my daughter was sick.
Yeah.
So anyways, that's my career juggling, mom trying to do everything. But I share that with you to say, when we're thinking about that from a women's health perspective, it's always in my mind, because we're all trying to do all these things and take care of all these things, but our health matters so much. And so getting those screenings and making sure that women have access to know what are the screenings they're due for. And maybe they're not, when we think about breast cancer, getting them to have that care and know their risks and know their family history, so that if they do have that history, they're getting screened all the much earlier, so that you have an incredible story like we just heard here. And so while we appreciate that the caregiving part is something that is real, and we support and want women to know that at every stage of life they have support to do what they want to do, we also want to make sure that that doesn't lead to delayed screenings, to putting their life on the back burner and putting their health on the back burner, because it is so crucial so that they can continue to do all they're trying to do.
So just before we close this out, I want to have a little fun with you both. I don't want to mention, because I'm always into out-of-the-box stuff, and you both have been extraordinary. We were together this morning. We were together last evening. For those of you who think that this was just a conference here today, no, there was even more in terms of lunches and dinners around this, and it's been an extraordinary experience for me. But you were a contestant on Price is Right. I need to share that. And you were. I have this great notes on you folks. You were a USA Today Academic All-American. Jessica is a National Breast Care Foundation Community Ambassador. You're out there kind of engaging all people in different ways. So great on the All-American. What did you win on The Price is Right?
I lost a car.
You lost a car?
I did lose the
you
car.
You lost a car?
And I spun over $1. It was not my best
$1?
day. But
You have nightmares about this?
It was some time ago. It was during medical school when I was doing a rotation out in LA. But I was so grateful, because I was called down right at the beginning. And it was right before Bob Barker retired, and I was so excited, but I couldn't get out of contestants row. And then randomly, I guessed $600 is the price of a wine cooler. And it was me, and I had the exact price, and the blinkers went off, and I couldn't believe it. It was a lucky
But you
day.
lost the car.
I did, yeah.
What kind of car?
I'm sorry, I don't remember.
Okay, good. That's probably good. We'll probably bring back some PTSD on that. But anyway, I want to mention, so in the spirit of thinking out of the box a little bit, out of our selves a little bit, as we just close up, and then John Parker is going to come up and share a few closing remarks here tonight. But and then we're going to go to the bar, because I want to go there badly. Have a drink with all our friends here. In the spirit again of bold bets, if you had whatever you needed to move the needle forward in your role on women's health, we've heard part of what's a priority for you, but add something to it. What would you like to see if we have you back a year from now, which we would love to do, both of you, but what would you like to solve?
I'll tell you, we're doing some really great solving things right now in pilots around maternal mortality. And so through some work we're doing through this perinatal improvement collaborative, we have over 220 hospitals across the US involved. And in so many cases, we hear the US is the worst place in the world to give birth. But in fact, it is an amazing place to give birth. And we want to make sure that hospitals have the best quality improvement interventions possible. And so through these 220 hospitals that we have right now, we've reduced maternal mortality by 41.5% compared to 5.9% in similarly situated hospitals over the same period of time. And so I share that with you to say there is hope across the board for women's health. And we, of course, appreciate that pregnancies where there are complications can lead to many conditions that are impact women lifelong, not to mention their baby's health as well. And so we're really thinking about that, but then we also just want to get to the root cause of diseases. And so I share, think about PCOS. Everyone knows about PCOS, but now it's renamed as polyendocrine metabolic ovarian syndrome, which really changes the whole idea of saying, what is the root cause of this most common cause of reproductive issues for women? And it's looking at insulin resistance. And I love that as an endocrinologist. And so in terms of next year, I really want to say, how can we get to the root cause and how can we reverse these conditions that impact women, not just during pregnancy, but over the course of our lives? And we really have, great pilots and things that we're working on, and we want to expand those across the country and really get in on that aspect of reversing chronic disease, because as an endocrinologist, it pains me so much when diabetes is painted as this chronic, progressive, hopeless disease, when we know that if we can, for type 2 diabetes and for patients who have prediabetes, there's so many ways that we can intervene early so that those chronic conditions don't have so many issues throughout the life. And so I love the reversing part.
Perfect. Jessica, you.
I'm going to keep it short, sweet, and simple. I want to see a healthcare system where insurance companies are not practicing medicine.
Wonderful way to end it. Well, please thank Jessica Baladad, founder and chief advocate, Feel for Your Life, and Dr. Dorothy Fink, Deputy Assistant Secretary for Women's Health at the Department of Health and Human Services. Thank you both for being here. Thank you. Will you hang out for a little bit after?
Absolutely.
Thank you so much. You're wonderful. Thank you very much for coming out. Thank you.